Hello, my name is Joseph Forrest, and this is an informative speech on the topic of the Emergency Severity Index. The Emergency Severity Index is an assessment tool that's used in many emergency departments throughout the United States. This tool is utilized in the triage area while the triage nurse assesses the lobby for patients that are coming in. What I want to ask the audience is, do you know what an emergency is? And are you able to tell the difference between what you're able to manage in an emergency department, or what necessitates the need for an emergency department, or what needs to be managed in a primary care physician's office or an urgent care center? Oftentimes, many people don't know the difference of this and are stuck waiting in the emergency room lobby while the other resources in the department are allocated to other patients. So this severity index was created and it's utilized by about 200 countries throughout the world. It has been proven to safely triage patients all the way from critical to stable patients. It's a 1 to 5 index, 1 being critical. This is, I want to know what is an emergency. That mainly patients want to know, am I next? They want to know, am I next to be seen? That's always the number one question that's asked by most patients. And we want to have patients seen as soon as possible, but with the possibility that there's another EMS that comes in through the door, or that there's a critical patient that can roll in from the parking lot. We have to keep some rooms open so that we're able to have patients seen and have them directly bedded if the need necessitates. Critical patients take priority. If a patient rolls in, patient's unresponsive, you have to ask yourself, is this patient going to die? If the patient's going to die or is in an imminent life danger, they are directly bedded to a room. That is the number 1 of the ESI Severity Index. Number 2, you have to assess AVPU. AVPU is an acronym that is used in order to quickly do a door assessment. It is the patient awake? Is the patient verbal? Is the patient alert to painful stimuli? Or is the patient completely unresponsive? If the patient is completely unresponsive, then the patient is directly bedded. If painful stimuli, consider a 2 to where the patient goes to the next available bed. If the patient is verbal to verbal stimuli, there might also be a 2. But if the patient is awake, they're probably going to be a 3, a 4, or a 5, depending on the amount of resources that are necessitated. This is the algorithm that all nurses are familiar with. It's the ESI index. Like I said, if it requires immediate life saving, they are number 1. If it's a number 2, they're a high-risk situation or they're an unstable patient. This would be if they're confused, lethargic, disoriented, and have severe pain. Number 3, this is the main population of patients that are seen in the emergency department. Most people that come to the emergency department do need to be seen. This would be if they allocate 3 minimum resources. I'll go over resources in a minute, but a 4 or 5 would be a 1 or a 2. This is something that we have to take in tow, is turnover time. The resources that are allocated for an emergency department, and this would go over my main points for a 4 or 5, the resources would be lab results, CT scans, x-rays, splinting, laceration repairs, or the need to consult with another physician or primary care physician. After researching and going all over all these different resources that are necessitated, you're able to determine how often or what the minimum duration of stay is in an emergency department. I hope that this tool is helpful, and I hope it's someday used to help you or your loved one in your dire need and whenever you're in the need. A quote by Robert Ingersoll is, "We rise by lifting others." So just think of that whenever you see a patient and you're in the lobby and they go directly to a room. think of that it might be he or she's last day, and can I wait while this patient is seen before I am? My name is Joseph Forrest, and thank you for listening to my informative speech on the Emergency Severity Index.